As when I had the head-on motorcycle collision, my head hit the handlebar, broke the helmet, and it...
Compress your spine.
Yeah.
Yeah. We got Joanne here, and Joanne's been a long-time patient of mine. Actually, before me, she was a patient of my dad's. How long have you been a patient now, Joanne?
30 years.
30 years she's been coming in here, and chiropractic how's it helped you? Why do you keep coming back?
Because it works.
We just got a bunch of cracks in your entire body pretty much, but there's one that we haven't done yet. We've saved for the camera today, right? This is called the Y-strap adjustment, and this adjustment, I don't do it on everybody, and I've been seeing Joanne for a long time, so we know
it's my favorite.
We know that this is a good one for her. So we're gonna go ahead and do that, and it's gonna help to elongate her spine and decompress a lot of areas. She's a hard worker, she gardens, she builds stuff, she pretty much is a DIYer, right? Do-it-yourselfer.
Mostly because when I had the head-on motorcycle collision, my head hit the handlebar, broke the helmet, and it...
Compress your spine.
Yeah.
Yeah.
And
so now we need to decompress it.
yeah.
All right, you ready?
It's almost there.
All right, let's get it done. All right, okay. Just relax there, Joanne. Think happy thoughts. How was that?
Great.
Yeah, we get it?
I think so.
Nice. Ooh-wee. All right. So Joanne, you first started coming in, you said about 30 years ago with my dad, right? And I've been seeing you now for probably close to 14, 15 years when I graduated from school.
Mm-hmm.
And you had a head-on motorcycle collision, right?
Mm-hmm.
And how did that affect your life?
Horrible. My body started to get tighter and tighter and tighter, like a vice grip. And I didn't even realize that I couldn't even turn my head to the left or to the right, which you could see that I can. I can't go all the way yet here, but I couldn't. I was doing this, and all of a sudden I broke my finger, went to the hospital. They gave me a Vicodin, and I got really scared because I didn't realize how much pain I was in. Athletic.
Now, I don't remember. Was your motorcycle accident before or after you had your kids?
It was before.
It was before? Okay.
And I couldn't even have my children naturally because from the motorcycle accident, my backbone from the accident went in so far that the babies would get stuck.
So you had to have a C-section?
So I had to have a C-section every time.
Yeah. That's too bad.
But now, if I needed to, which I'm not, I'm too old,
yeah.
But I could now because it's gotten, I'm pretty much straight now.
And
so.
How is, now you mentioned they prescribed you Norco before. How is taking those pain meds different from chiropractic for you? They both relieve pain, right? But how are they different from each other? Why would you choose one over the other necessarily? What situation?
I never wanted the Norcos. I had no choice because of the intensity of the pain. For 5 years, all I did was cry. 24/7, 365 days a year, because even the Norcos didn't work, but it still helped to relieve. And all I knew is I wanted to live. I didn't want to die because I thought I was going to die because it was that bad.
Yeah, when that was going on that long. Did you feel like those Norcos were fixing the root cause of your issue?
No, but they
just helped you feel better?
Coated it. Like
so you feel like it was just masking it?
It was masking it, 100%.
Okay, and how do you feel like chiropractic is different than that?
It fixes it.
Yeah.
Doctors don't fix it.
Well, that's the tool they have in their tool bag, right? And thank goodness we have it in certain life-saving situations, but it's a chemical tool.
I've even...
And you're not going to treat a mechanical issue with a chemical tool. You need a mechanical tool to fix a mechanical issue, right?
Exactly. They even put me through physical therapy, and all physical therapy did was hurt me.
Yeah.
Because I'm strong and what they were trying to do wasn't working. So I just quit.
Well, there's not one thing that works for everybody. So thank you for keep trying, and thank you for being such a great patient coming in. It's, I wish I had a million patients just like you. It's a joy having you come in. We always get together really well, and I can tell it's working for you. So that brings me a lot of joy too. So thank you. Appreciate you.